If your knees ache every time you stand up from a chair, or that familiar stiffness hits within the first few steps of your morning, before your body has even had a chance to warm up, your doctor may have missed something critical, something that changes how you understand knee pain and what you can actually do about it starting today. There is a muscle that controls the majority of the force going through your knee joint with every step you take, every time you lower yourself into a seat, every time you climb a single stair. And for most people living with osteoarthritis or chronic knee pain, that muscle has quietly and gradually switched off. Not because of age alone, not because your body has given up on you, but because of a cycle that begins the moment pain enters the picture and quietly feeds itself from there. Today, I'm going to show you a simple 10-minute chair trick. No equipment, no gym, and no complicated movements that require balance or flexibility you may not have right now. That reactivates that muscle and begins restoring the natural support system your knee was always designed to rely on. We are going to do it together right now, and by the end, you will understand your knee in a way most people simply never do. Before we start moving, I want to take just a moment to explain why this works, because once you understand the reason behind it, you will actually stick with it long enough to feel the difference. Your knee does not hold itself up with bone alone. It has an internal brace, a powerful muscle called the quadriceps, running along the entire front of your thigh that absorbs shock, controls movement, and takes load off the cartilage underneath. Think of it as a shock absorber. When it is strong and active, the joint is protected. When it weakens, every impact goes straight into the joint itself. Osteoarthritis does not just wear away cartilage, it also disrupts the connection between your brain and that muscle. Pain triggers a protective response. You begin to guard the knee without realizing it. You use it less. The muscle weakens from underuse. The joint absorbs more force than it was built to handle. And the cycle quietly gets worse, month after month, while most people assume it is simply age and there is nothing to be done. What we are doing today breaks that cycle at its source. And it starts with nothing more than a simple chair. Grab a firm, sturdy chair. A dining room chair works perfectly. Avoid anything soft or padded that lets your hips sink below your knees. Sit right on the edge of the seat, not leaning back against the rest. Keep your back straight and your shoulders relaxed. Place your feet flat on the floor, about hip width apart. If you need a little extra balance, go ahead and hold the sides of the chair. That is completely fine and will not reduce the benefit of the movement at all. Start with your right leg. Slowly begin to extend your knee, lifting your foot off the floor. The movement should feel deliberate and controlled, not a swing, but a smooth and intentional straightening. As you lift, point your toes gently up toward the ceiling. That small detail helps engage the quadriceps through its full length, which is exactly what we want. Keep extending until your leg is as straight as you can comfortably get it. Do not worry if it is not perfectly straight. Just go to your pain-free limit and stop right there. That limit is valid. Work within it, not past it. Now place your hand on your inner thigh, just above the kneecap. Squeeze the large muscle on the front of your thigh, your quadriceps, as firmly as you can. Focus on that contraction. You should feel the muscle tense and become firm right under your fingers, almost like a fist tightening beneath the skin. That sensation is exactly what we are looking for. If you find it difficult to feel at first, try thinking about pulling your kneecap upward. That mental focus genuinely increases muscle activation. The mind-muscle connection is real, and it matters especially when a muscle has been dormant for a long time. Hold it right there. Keep breathing normally. Do not hold your breath. We are going to hold this squeeze for 5 full seconds. 5, 4, 3, 2, 1. This type of contraction, where the muscle works hard without the joint moving, is trouwens charker an isometric hold. It is especially valuable for people with joint pain because it builds real strength without the repetitive grinding movement that can irritate already sensitive cartilage surfaces. You are loading the muscle, not the joint. Now, just as slowly and with just as much control, lower your foot back down to the floor. Do not let it drop. Fight gravity on the way down. This controlled lowering phase is just as important for building strength as the lift itself. It is what trains the muscle to protect your knee when you walk downstairs or lower yourself into a seat. That is one complete repetition. Everyone's pain is different, so here are 3 ways to adapt this movement to exactly where you are right now. If lifting your leg is too painful, keep your heel resting on the floor and simply tighten the thigh muscle without any movement at all. Place your hand on it, focus on making it firm, and hold that squeeze for 5 to 10 seconds before relaxing. That is called a quad set, and it is still doing the neurological work of rebuilding the connection between your brain and that muscle. It is the perfect starting point, and there is no rush to leave it. When the basic lifted version feels manageable, progress by extending your hold to 10 seconds instead of 5. You will feel the difference immediately, and when 10-second holds begin to feel genuinely easy and completely pain-free, you can consider adding a light ankle weight, 1 to 2 pounds to start, to accelerate your strength gains. But only move to that stage when the unweighted movement is entirely comfortable. Aim for 2 to 3 sets of 10 repetitions on each leg. Complete 10 controlled reps on your right leg, switch to your left for another 10, then rest for about 60 seconds. Repeat that 2 more times and you're done. The whole session takes roughly 10 minutes. Research on structured exercise programs designed for knee osteoarthritis shows meaningful improvements in both pain and physical function in as little as 8 to 12 weeks of consistent practice. That is real, measurable change from a chair in 10 minutes a day. But the word that matters most in that sentence is consistent. 5 perfect, controlled repetitions every single morning will always outperform 50 rushed or painful ones once a week. Consistency is the real medicine here, not intensity. As your strength grows and this movement starts to feel natural and comfortable, begin layering in other gentle work. Heel slides are an excellent next step. Lying on your back and slowly sliding your heel toward you and away safely improves your range of motion without loading the joint at all. From there, low-impact activities like walking, cycling, or swimming become powerful additions. These movements circulate synovial fluid, your joint's natural lubricant, which nourishes whatever cartilage you have left and keeps the knee moving with less friction and resistance. Without movement, your joint becomes like a rusty hinge that gets stiffer and more painful the longer it sits still. With this program, you're finally adding the oil your knees have been starving for. Above all, become a careful student of your own body. There is a meaningful difference between the productive discomfort of a muscle being challenged, a mild burning in the thigh that fades quickly after you stop, and the warning signal of sharp, stabbing pain deep inside the joint itself. The first is progress, the second is your body asking you to back off and return to an easier version. That is not failure. That is intelligent training. Healing is not a straight line, and some days will feel better than others. The secret is simply showing up anyway, doing what you can, and trusting that the consistent effort is building something real, even on the days you cannot feel it yet. And you did not just watch a video today, you took action. And that already puts you ahead of most people who stay stuck in the same cycle for years. Every repetition you completed sent a direct signal to your nervous system. I am fighting back. I am getting stronger. I am not done yet. And that is exactly the path that leads back to the garden you have been missing, the long walks you have been avoiding, the mornings where standing up is simply standing up again. If this helped you today, please take 1 second to hit the like button. It helps this reach someone else who is sitting right now in the same position you were in when you started watching. And if you want the next step, the heel slide routine to safely improve your range of motion, subscribe and turn on notifications. I will have it in your feed this week. Stay consistent, keep listening to your body, and I will see you in the next video.